with questions, so I've been going through them all. What I thought I'd do for the next half an hour is talk about more unusual symptoms. And actually, as you know, everybody's experience of the perimenopause and menopause is different. We're all individuals, and how we experience things is very different. For many years, we've been told that perimenopause and menopause is about hot flushes, night sweats, vaginal dryness, maybe low mood. And that's all, because as you know, the menopause has been defined as a year since a woman's last periods. Very little about symptoms, but actually over centuries people have described what symptoms are, and how menopause and perimenopause can affect people in different ways. But every day when I see people in my clinic, I'm listening to women telling me that these changes have occurred in their body. They're experiencing symptoms they haven't had before, or they've been investigated by other doctors and no cause has been found. And then when I give them the right dose and type of hormones for them, these symptoms improve. So the proof is in the pudding. We know it's related to their hormones. So before I get started, I just wanted to remind you the hormones we're talking about. So there's hundreds of hormones, but all I'm talking about is estrogen. And when I talk about estrogen, I actually talk about estradiol, which is the nice estrogen. It's biologically active. It's a really important estrogen. So there's estradiol, there's progesterone and testosterone. And I've spoken about them at length before, but just to remind you that they affect every single cell in our body and they have important biological effects. We've done these posters, which I have shown before, and they're on the Balance website. And they're very, very basic, showing the influence of estrogen in our bodies. Then there's one showing about the influence of progesterone in our bodies. And then finally, testosterone. Now we've divided up into different organs, but this is just a snapshot. There is a lot more that these hormones do that we just haven't put. But this is just to let us remind ourselves that these hormones work everywhere in our body. And these hormones, estradiol, progesterone, testosterone, are produced in our ovaries, but they're also produced in other organs, especially in our brain. They're actually manufactured and made in our brain. And some of you might know I'm very interested in the brain. I'm very interested in neurophysiology, i.e. how the brain works. And how the brain works, a lot of the symptoms you're describing are related to our brains. And if you know that our hormones work across all our brains, every single cell, and when we have fluctuating or low levels of the hormones, it can trigger various symptoms affecting our brains. We know that people can have low mood, have memory problems, reduced energy, poor sleep. Obviously the flushes and sweats can originate in the thermoregulatory part of the brain. But the brain does much more. It sends signals to the rest of our body. And if these signals are interrupted or not optimized, it's going to cause other nerve type symptoms. So one of the things that a lot of people have been asking is about anxiety, which is very, very common, but also rumination, which is when you overthink things. So something that might be quite a small thing that just happens, you worry and worry. So I've just cut my finger trying to cook supper for later on a tin. It was very superficial. It's fine. I've put a plaster on. It will be fine. But if I was ruminating, I'd be worrying that it was maybe it needs stitches, maybe it's going to get infected, maybe I'm not going to be able to hold my pen, maybe I'm not going to be able to work, maybe I'll get gangrene. And you can see how this escalation of thoughts can really control people's minds. And that's a very, very common symptom, so lightheaded. And it might be just that the room is spinning, but a lot of people find when they stand up suddenly they become quite dizzy, or they move their head quickly, become dizzy. Now we have receptors all around our body that are determining, especially in our inner ear, but also throughout our blood vessels, our cardiovascular system. So if I suddenly stand up, my blood pressure's got to rise so that I can get enough blood to my brain, otherwise I'll be dizzy. If these baroreceptors, they're called, aren't activated in the same way, then I'll stand up and my blood pressure will drop, or it won't increase, and that can make me feel dizzy. The inner ear is got lots of nerve cells and lots of little fibres, sort of like little fibres that are wafting in the breeze almost, and they're constantly determining where our head is going, what's happening. And these little cilia, they're called, If they don't work very well, they're not sending the right nerve impulses to the inner ear, which then goes to our brain. It's not going to recognise if I move my head quickly, and that then, and the hormones often control those actions. So if I don't have hormones, or the levels are fluctuating, and I move my head quickly, it might make me feel off balance and dizzy. So there are lots of reasons why people can be dizzy. Most commonly, as doctors, we think about the heart, the cardiovascular system and blood pressure, and also the inner ear. And so those two areas can be really affected during perimenopause and menopause. Another symptom that a lot of people get is tinnitus, this ringing in the ears. And I see a lot of people who have been investigated by ENT surgeons, by maxillofacial experts, no cause found. And that's often related to the way that the nerves are not working properly, firing off confusing signals, and people can get this tinnitus, this ringing in the ear, which can be incredibly distracting. Thinking about the ear, quite a few people asked about TMJ dysfunction, so temporomandibular joint, which is this joint up here. A lot of people find that they get clicking, or they're grinding their teeth at night, or they get a lot of pain in their jaw. Really common symptom, and again, this can be related to hormones. We know that our hormones are anti-inflammatory in our joints. This is a very small joint, there's not much room for movement. And so if there's inflammation in that joint, it can cause pain, discomfort. When you open and close your mouth, it doesn't feel quite the same. And then, as I've already mentioned, anxiety can be very common. What's one of the things that happens if we're anxious? We clench our teeth. If we're having nightmares, we're not sleeping well, we can be clenching our teeth. So those two things together can be really affected. When we think about anxiety, people have been asking about ADHD, and ADHD can often worsen during perimenopause and menopause because our hormones are so important on our brain. They help with our brain processing, and a lot of people who have some mild ADHD often find that that worsens, and again related to the role of hormones in our brain. Thinking just anatomically, I'm sort of working down the body here, so I try and remember everything that you've asked. Think about our eyes. People have been asking about dry eyes, very common symptom, but also watery eyes. Now, watery eyes can actually be due to not having enough tears and lubrication in the eyes. Our organs, including our skin, then we're going to be healthier, of course. So the skin is a window to what's going on inside. Few people have asked about eczema. So eczema can worsen in the skin. There's increased skin turnover, lots more cells, more moisture loss, less blood supply going to the skin, more inflammation as well. So eczema can be more common, psoriasis can be more common, rosacea can be more common. Sometimes people have acne as well that can reactivate as well. So that's very common. I forgot one thing about the ears, sorry to go back to the ears. Somebody asked about something called hyperacusis, which is when you're very, very sensitive to noise. So like that ticking clock that you might not bother about, it might be the most irritating thing that you've heard, and any sounds are amplified. So someone eating, I know when I was perimenopausal, the sound of my husband eating his food just drove me mad. And that wasn't because it was my husband, it's just his mouth was closest to me around the dining table, and I could just hear it more than I'd ever heard before. So if you're more aware of sounds, again, that's because your brain can be on a bit of hyper alert because it's not working as well without the hormones. So that's another symptom. Thinking about the mouth, quite a few people ask me about their teeth as well as their gums. Now, all our hormones go everywhere in our body, like I've said before, and mouth and teeth problems can be really, really common, and I have written about it in my book as well as online. People might find that their teeth become more loose, they might find that they have swelling, gingivitis, so swelling and inflammation of the gums. People might have sore mouth, and burning mouth syndrome is something that can be very common in women. When we think about what's common in women, we need to be thinking about hormones, of course. And so any mouth problems, ulcers can be common. A few people have asked about angular cheilitis, so sort of pain on the edge of the mouth. That can be related to other vitamin deficiencies like folate and vitamin B12. But again, thinking about hormones, I've seen a lot of people that have really improved when they've had the right dose and type of HRT for their mouth symptoms. Then following the mouth down, the mouth is the opening to our gastrointestinal system, starts with our mouth and ends in our anus. We've got cells lining our gastrointestinal system that respond to estrogen, progesterone, testosterone. So people can get heartburn, they can get reflux. There are some people that have quite a lot of vomiting as well. If you listen to a podcast I did with someone called Corinne, who's got early menopause, she's got premature ovarian insufficiency, she talks about when her estrogen level is too low, she gets quite severe vomiting and had all sorts of investigations, but it was actually related to the imbalance and her hormones were too low. So that can be very common. Bloating can occur and also change in bowel habits. Some people might find that they get more constipated, their bowels are quite sluggish, they might have more wind. Someone asked me about wind. And our gut flora can change as well. So our hormones, especially estradiol, but I think probably testosterone and progesterone too, although little research has been done in it, actually can affect the way that our gut flora is. We want to have a good microbiome in our body, but if our hormone levels are down, it can affect our gut microbes, as well as obviously not eating the right foods, not exercising, not looking after ourselves can affect. But certainly when people have hormones, and increasingly I see women who have been diagnosed with irritable bowel syndrome, give them HRT, add in testosterone, and their irritable bowel symptoms really improve as well. No surprise when we know that we've got cells that respond throughout our gastrointestinal system. Our lungs as well can be affected. So some people have asked about breathing difficulties. Some people might be diagnosed with asthma or might have worsening COPD, or they might just be a bit short of breath at certain times. And even people who've got PMS, PMDD might find they just have breathing difficulties before their periods when hormone levels are at their lowest. And we know that our hormones work to open up the lining of the, or open up the bronchioles, which is the airways. We've got our main bronchus, we've got a left and a right bronchus, our main they're like big straws that go down into our lungs, and then they divide into these bronchioles and get smaller and smaller, and then they have alveoli, these tiny little balloons, if you like, at the end, where all the oxygen transport goes from our lungs into our bloodstream. Well, you can imagine if there's more inflammation, if there's narrowing without those hormones, then it's harder for the air to get down, and then harder for it actually to get into the alveoli and transfer into the bloodstream. So hormones absolutely can have a role. Obviously, there's lots of reasons why people can have shortness of breath, worsening asthma. So don't put everything down to hormones. And that's just to add, really, it's really important as doctors, we're not blaming all these symptoms due to hormones, because if I did, I would be missing other diagnoses as well. And so as a general physician, I'm very primed to be thinking, what else is going on in this person? Could they have asthma as well as breathing difficulties due to their hormones, for example? And I wouldn't want to be just giving HRT without thinking about asthma treatment. And that's why, if any of you are seeing doctors or nurses or pharmacists, make sure you see people who are trained very holistically and can look at other conditions. So I don't want any of you to be listening to this Instagram live and thinking, hang on a minute, she told me that my tinnitus is due to my hormones, therefore it can't be due to anything else. Of course I'm not saying that. So often in the clinic we see people who have been fully investigated for these symptoms and come to us because the women are often saying, I think it's related to my hormones, and they've got other symptoms as well. So it's a collection of symptoms too. The other thing, thinking about breathing, thinking about smelling as well. People can get change in smell. They might find that they smell things more strongly, and that can be quite common actually when hormone levels are high and changing. So certainly in the perimenopause. During menopause, often people find that they smell things less. But there are a lot of people that say, oh, my body odour's changed. or I can just smell things in a different way. And that's often related to the hormones rather than their body odour actually having changed. People might smell perfumes differently or food differently. And obviously if you smell food differently, it might taste differently as well. But our taste receptors can be affected too. So important that we think about that if we're getting any changing smells. Obviously with COVID, changing smell or loss of smell was a very common symptom of COVID. And of course it can be due to other reasons as well, but it's just another unusual symptom that people can get. The other thing, thinking about the vasomotor symptoms, flushes and sweats, that we've been told for many years is the main symptom of menopause. Actually, it's not the main symptom. Like I've said before, the main symptoms affecting our brain, especially brain fog, memory problems, anxiety, low mood. But people describe their flushes and sweats very, very differently. Of course they do. But some people notice this sort of cold chill rather than a hot sweat. The other thing that's very common actually that we're hearing more and more is this internal tremor feeling that people can get. They literally feel it's from within and they're tremoring inside. It can be very disconcerting. Or they talk about a sort of a vibrating sensation going on in their body. Might be part of their body or their whole body. And that can often be related to the changing hormone levels because of the way our hormones affect our nerves, our physical nerves, not our being a bit more anxious, the actual conduction of the nerves as well. And if the signals are confused without the right hormones, the nerves aren't working properly, the synapses, the sort of junctions between different nerves, the signals aren't being fired through the synapses properly. There's lots of confusion and chaos in the body, and people can get these vibrating symptoms that can occur. The other thing to think about is just working out what else. Fatigue, very, very common symptom. Lots of reasons why people get tired. But even if they're sleeping well, they often find that they're really overwhelmed with tiredness because of the hormones affecting our brains. Weight gain is something people have asked, and I've spoken about weight changes before, and they can occur sometimes due to lifestyle changes, but often due to metabolic changes that can occur. And menopause is a cardiometabolic syndrome. People's metabolism changes. The way that we utilise glucose is different. The way we use insulin in our body is quite different as well without the hormones, because especially estradiol, but also progesterone, testosterone affect our metabolism in really well as well. And often people with these metabolic changes find that their blood pressure increases and their cholesterol can increase as well. So a lot of people I see are told, oh, you've got raised cholesterol, we need to give you a statin. But actually, if these people otherwise have a low cardiovascular risk, we often balance their hormones first, wait a bit, monitor cholesterol and find that it does come down with time. So you don't need to necessarily rush and think about a statin or anything else. One of the things people were asking is about swelling. Some people get fluid retention, and often that can be related to changing hormone levels, especially in those people that are perimenopausal or have PMS, PMDD. And it's often due to changing progesterone levels. Some people find if they have a synthetic progesterone, which blocks natural progesterone, doesn't work the same in the way that body identical progesterone does. It can be related to that, and giving back the right type and dose of progesterone plus or minus the other hormones can actually help swelling as well. Now, the other thing that people were asking about, a lot of questions about the immune system and also autoimmune conditions, and it's all linked together. And I have spoken about it before, but we have cells that are in our immune system. We have different types of cells. Some of you might have heard of a word called lymphocytes or leukocytes, which basically leuko is white and cytes is cells. It just means white cells, as opposed to red cells, which carry our hemoglobin and our oxygen and iron in our blood. So the white cells, the leukocytes, actually are fighting infections and inflammation in our body. And we've got different ones. So cells such as macrophages, monocytes, eosinophils, these are all type of mast cells. They're all type of inflammatory cells. They've got receptors on them for estrogen, progesterone, testosterone, as well as for many other hormones as well. But when hormone levels are low, it can change the way our immune system works. They don't work as well. When we have estrogen and the other hormones, progesterone and testosterone, but estradiol in our system, the immune cells work better. So they can fight infection. When we've got estradiol in our bodies, it increases the number of our immune cells, our cells that fight infection. It can genetically reprogram them. It can also change the cytokines, the good chemicals and bad chemicals that are produced from them to fight any infection. Really important, because we've got this balance of like good and bad chemicals, balance of these cells to fight anything that happens. So if I breathe in, there's always going to be germs in the body. There's always going to be germs in the air that we might breathe in, and then I don't want to be ill every time I breathe, of course. So my immune system is fighting infections all the time, but also any inflammation in the body. Our body wants to be healthy, so it reduces inflammation in the body. So these white cells will reduce inflammation. A lot of people, when they're perimenopausal or menopausal, will find that they have more infections. So they might have more colds, they might have more viruses, they might have more bacterial infections. A lot of people find that they get shingles or they get more cold sores, and this again is reactivation of the chickenpox virus, as many of you know, but it reactivates because our immune systems aren't as good. Our immune systems can be lowered for all sorts of reasons, but one of the reasons is, guess what? Menopause or perimenopause, because of our low hormones. But our immune systems also protect us from diseases as well. Many of you have heard of autoimmune diseases, which basically means that our immune function is changed so it fights ourselves. And so there are different autoimmune conditions, such as celiac disease, type 1 diabetes, thyroid disorders, different types of arthritis can be autoimmune diseases. And they're more common in women than men, and it's likely to be related to hormones. I'm doing quite a lot of work with lupus at the minute, and somebody did say today that Lupus UK say that we can't give HRT. That's right and wrong. We shouldn't really be giving synthetic HRT, but body identical hormones can be fine and safe, making sure it's the right dose and type. And often we'll start with progesterone and testosterone and then sneak in some estrogen, because estrogen can be more inflammatory for some people, especially with lupus, than others. It's all individualised, of course. People have asked about mast cell activation and histamine intolerance, which often goes hand in hand with mast cell activation. Mast cells is a type of immune cell, and some people find that they become more activated during the perimenopause, and this can be due to lots of reasons, but one of the reasons is the imbalance of hormones, because our hormones work together really well. And so often we find that it can be due to progesterone deficiency and maybe testosterone deficiency. So again, for people with mast cell activation or histamine intolerance, we'll often try giving progesterone and testosterone rather than estrogen first, and that can make quite a difference, as well as thinking about histamine diet, low histamine diet of course, and maybe some antihistamines and other supplements as well. What I'm trying to highlight is that we're all different, and so it's really important. I'm not here saying we always do X, Y, Z, because of course we don't. We can be quite different and individualised. And if something doesn't work, or one type of hormone doesn't work, then we'll pivot and look and think about elsewhere. The other thing, just working down the body, a few people were asking about discharge. So vaginal discharge, thrush, can be very common, but actually it's probably not thrush. It's an alteration of the flora that's in the vagina. And I used to see loads of women as a GP who thought they had recurrent thrush, and I never thought about giving them vaginal hormones. So if any of those women are watching, I'm very sorry, because I didn't know, no one taught me. But now often giving vaginal hormones, we can give vaginal estrogen, or we can give vaginal DHEA, which is prasterone is the other name of the pessary. daily pessary, which will convert to estrogen and testosterone in the vagina and the surrounding tissues, and it can reset the vaginal flora. It can really improve discharge as well and other symptoms as well. And local hormones can be given with or without HRT. They only work locally, very safe to people who've had breast cancer as well. They're very safe and should be considered if you've got any change in your vagina that's either it's dry, it's irritable, it's painful, or like I say, even if you've got more discharge or change in discharge. Of course, make sure there's nothing else going on, but it could be related to hormones, and sometimes we as patients have to alert healthcare professionals to say, could I have a trial of hormones? Do you think it would help? So there's lots of information I've given. I know I talk very quickly, and lots of symptoms. I've really tried to cover all of them. I honestly do read every single message that you send, so I can try and bring it together, because I do understand that a lot of you aren't being listened to, not being taken seriously. There is still quite a lot of symptoms are dismissed, and I don't think as a healthcare professional my job is to dismiss any of my patients. My job is to listen and learn, share uncertainty. If I'm not sure a symptom is related, I will tell the patient, work with the patients to optimise hormones. And remember, there are many different types and doses of hormones. So if you think your symptoms haven't improved, but you feel they're related to hormones, then it is thinking about, should I change the dose or type or formulation? Should I see someone who really understands how to optimise hormones? And also look at, is there any other reason for me to getting these symptoms? Maybe it's not all related to hormones, and that's really important as well. So looking at us as a whole, we are whole human beings that deserve attention in entirety, rather than working in silo and just looking at each organ. So I hope that's been helpful. I will share some resources. For those of you that are in the UK and had some sunshine, I hope you've managed to enjoy some of it today. I hope you have a really good week. And just finally, actually, what we are trying to do is create a new symptom questionnaire to incorporate some of the symptoms. And I might, when we've just got it in draft, I'm going to share it with some of you to see what you think, whether you think it's a good questionnaire to cover some of the most common symptoms. We can't cover all of them. If you've got any symptoms that you think definitely should be in a questionnaire, just put them in the chat when I post this, and we will definitely think about including them, because we need your support. We learn all the time from you. So working together with women who are experiencing symptoms is going to be really useful for this project. So thanks again for all your support, all your shared words of wisdom, and we're going to do it together. We're really going to make a difference for future generations. I feel really positive at the moment. So keep your positivity coming towards in this direction, and let's see where we can get to over the next few months. So enjoy the rest of your evening, and thank you.